get closer than that. Okay.
I'm going for it.
So this one, I'm going to go from cranial to caudal, from 1 to 12. So the olfactory bulb is sitting here, and the olfactory nerve you can't really see because they're individual fibers that come out of the olfactory epithelium, go through the cribriform plate of the ethmoid bone, and then insert into the olfactory bulb. And so when you pull the brain out, those little fibers get shorn off. So that's one. Cranial nerve 2 is the optic nerve coming off the chiasma here. These fibers are axons from the retina, the ganglion cells in the retina, and they collect at the back of the eyeball and exit, and then come to the optic chiasma, and some of them cross as the contralateral optic tract, and some stay on the same side as the ipsilateral optic tract. Same fibers, 3 different names. Out here, they're optic nerve. Where they cross, they're optic chiasma, and where they go up towards the thalamus, they're there. When they go up towards the thalamus, they're the optic tract, and then they'll terminate in the thalamus and the superior colliculus, etc. So that's 2. 3 is the oculomotor nerve, and this is the first one of 3 nerves that go to the eyeball moving muscles, the extrinsic ocular muscles. So the oculomotor is this large one that comes off the floor of the midbrain, the mesencephalon. It's torn off on this side, and it's torn off on most of the brains you guys are looking at. It's in good shape here. That's 3. 4 also comes out of the midbrain, but it exits the dorsal side of the midbrain, and so you can see this bundle right here coming around the side. It exits the dorsal side and then curves around and goes out to the orbits with the oculomotor. That's trochlear. I'll skip 5 because the third of those is 6, the abducens. And the abducens comes out just caudal to the pons off the floor of the brainstem, and you can see that here. And it will travel also with 3 and 4 to the orbit. Number 5, I skipped. Number 5 comes out right about, not in the middle of the brachium pontis, but in between the fibers of the brachium pontis that are going up from the pons up into the cerebellum. And so on these preps, you'll usually see a stub, a smoothed over stub where it's torn off. If the dura mater is still intact, you'll see a large nerve, a large bundle of fibers that goes into the dura mater. It's going to be distributed to the facial region. That's the trigeminal nerve. 6, I just mentioned, is abducens. 7 is just caudal to the trigeminal nerve, and you can see a little stub of it here. That's the facial nerve. Comes out very near where the trigeminal nerve does, but it's much smaller than the trigeminal. 8 is the vestibulocochlear, and it goes directly into the internal acoustic meatus, into the petrosal portion of the temporal bone to the inner ear. And so it gets torn off as you pull the brain out of the cranium. It gets torn off. But in this one, you can see a little tiny clump of fibers that come out. And just caudal to that are a series of little roots or rootlets that are 9 and 10. The first of these, the most cranial of these, is the glossopharyngeal, 9. And then there are several, 5, 6, 7 of them that are the vagus nerve, cranial nerve 10. 11, you can see on most of these, on the side of the spinal cord and medulla, is this pretty large bundle of fibers that includes spinal nerve fibers that are moving up into the cranium, where they're joined by some other fibers from the side of the medulla, and they exit to go stimulate the muscle activity in the shoulders, or the superior cranial muscles of the shoulders. That's the spinal accessory nerve, and it's called spinal accessory because it's a cranial nerve that receives fibers from the spinal cord as well. And then 12 is in the floor of the medulla. And you can see just before this is where the foramen magnum would be. So this is medulla, this is spinal cord. And just cranial to that foramen magnum, from the floor of the medulla, you can see these little rootlets coming off the ventral surface. That's hypoglossal. That's a motor nerve that's going to stimulate the muscles of the throat area and the tongue. So that's 12. So that's 1 through 12. Piece of cake.
How do you feel about embryos being frozen?
I prefer them frozen, actually.